Our next speaker is Dr. Dianalee McKnight, who is the Medical Affairs Director. Is a Medical Affairs Director in Emerging Clinical Omics at Invitae.
Hi, thank you for allowing us to speak on our comments. So I'm representing our laboratory today. It's Invitae is a diagnostic laboratory that provides diagnostic and screening genetic testing, mostly in the US, but also internationally. I think a lot of what we're going to say here, what I'm going to say here is reflective of what the past few speakers have also said. So we recognize that race, ethnicity, ancestry is a socio-political identifier, and it's not really a good proxy for biology. We also recognize some limitations in how we collect this information. It's known that self-reported REA is not necessarily consistent with genetic ancestry. It can be subjective depending on context. And there's plenty of reports that show that there's mismatch between self-reported and genetic ancestries. We also, because our testing is ordered by clinicians, are very aware that although we call our REA self-reported, in actuality, it's mostly physician-reported or even physician office staff reported. And we have a study right now to look to see how these two actually would correlate with each other. How closely are they representative or not? We know it's not 100%, but how far off are they? So we do use the provided REA for a couple purposes in our laboratory. Firstly, I want to say that it is not generally used for variant classification. So the patient's reported REA is basically agnostic to the analysis that's done for the patient and their genetic testing. But we do have uses outside of the actual diagnostic testing. One includes billing, and our medical system does have race, ethnicity, ancestry data sort of worked into the framework. So one of which is a CPT code and how we are able to get paid for carrier testing that's done for Ashkenazi Jewish individuals. The code is written specific for those individuals. And then we also have at least one payer, a private insurer, that will sometimes ask if a patient is Ashkenazi Jewish to approve a hereditary breast and ovarian cancer testing. So that is an unfortunate place where this information is used. Where we do also use it and appreciate the ability to use it is to ask questions around access and equity issues. So we know that there's disparities in medicine, there's disparities in our public genetic databases that we use, and also in the medical literature. And because we're relying on all of that to use that information to accurately classify variants for patients, we need to be able to ask questions, well, is that affecting how we're able to do variant classification? And the answer is yes. And now that we've been able to identify that, we're able to use tools and ways to try to get around some of those gaps in information and better classify variants in individuals, regardless of what their genetic background is. So, but without that information, we wouldn't be able to ask those kinds of access and equity issues. We also are able to look to see if we're meeting geographic regions with our testing. Are we seeing that there's areas where we're not meeting the population and possibly genetic testing is not being offered to certain populations? And again, we're able to ask those questions and possibly address them. So future improvements, and this was reflected in our comments, was that we would like a more standardized use of haplogroups. Ideally, the genetics community could come together and have standardized haplogroups that are agnostic of presumed geography or culture. For us, that's not really needed. We just need the genetic background. And mainly we need this to understand variant frequencies, allele frequencies that could help us better classify variants. And ideally, these databases would be more representative of individuals worldwide and not skew towards certain populations. And we do look for guidance So we look forward to engaging with this community and the broader community to reach a consensus on how we can accurately and respectfully collect these population descriptors. Thank you.